Hello, I'm Kat Baker, consultant colorectal surgeon here at the Manor Hospital in Oxford. Okay, so we're delighted to have the Vinci Xi robot here at the Manor and to be able to offer robotic colorectal surgery. Robotic surgery is a bit like laparoscopic surgery, where small cuts are made on a patient's abdomen and ports are inserted, but unlike laparoscopic surgery, where the surgeon's at the bedside, the robot is then docked onto those ports, and the robot is then controlled by the surgeon who's in the operating theatre, who sits at this console, driving the robot, in full control of the robot at all times, to enable precision surgery with tiny movements facilitated by the robot to carry out the operation. So there's huge benefits of robotic surgery. We know that using minimally invasive surgery has a much less physiological effect on patients. They're able to return to work sooner, they're discharged from hospital sooner, and on large volume studies it shows that there's lower blood loss, lower complications, and in oncological surgery, particularly pelvic surgery, there can be a reduction in a positive resection margin, which means a better oncological operation. There's huge benefits for patients such as with inflammatory bowel disease, which is often complex surgery with abscesses and fistulae, and the robot enables us to carry out huge operations on often quite unwell patients, but using really minimally invasive techniques and doing safe anastomoses, so joining the bowel, having resected it, often joining inside the abdomen, using precision suturing and stitching, which we're just not able to do laparoscopically. So having the robot is absolutely life-changing as a surgeon. I trained in robotic surgery in Brisbane, Australia. I've been a robotic consultant surgeon here in Oxford for 5 years and I've done a huge volume of cases. And now at the Manor we offer robotic surgery for colon cancer, rectal cancer, inflammatory bowel disease, diverticular disease, a full range of colorectal procedures. As a surgeon, we're able to sit at the console. We have a 3D view, whereas laparoscopically we had a 2-dimensional view of the operating field. It's often very different going back to 2D operating, because you then realise the incredible view that the Da Vinci robot offers us, and that enables me to see really clearly the nerves and vessels and all the structures that we want to protect and preserve, and get a much better view of the tumour or whatever we're operating on, often deep in the pelvis. So the other thing you'll see about the Da Vinci is there are 4 arms. So I'm able to have an instrument which is docked and using it perhaps to retract some tissue gently, giving me a better view, and then operate with my other 2 hands. And this enables us to see much better, and often, as I say, these patients have tumours deep in the pelvis, and it's procedures which would be otherwise very challenging laparoscopically. So the robot enables us to have a better view, to have precision operating with millimetre dissection. So the other great thing about the Da Vinci is the instruments have articulating wrists. So the instruments are able to move in a huge range, 360 degree, and that means that as a surgeon, where we're limited by our own limbs, the robot instruments, when we control them, we're able to angle them to exactly the point that we want to dissect, so we get much more precise operating, and there's absolutely no compromise. We get a very precise dissection. And with the robot there's also stapling technology, so we're able to safely staple the bowel to form an anastomosis if needed. And the articulating instruments mean that when we stitch, when we suture, it's very straightforward to perform complex stitching, even deep in a pelvis, afforded by the robot's technology. Okay, so patients coming to the Manor to have a colorectal resection will often require some bowel prep the day before the procedure to clean out the bowel, but we'll advise you about that. You'd come into surgery and you'd be admitted by the nursing team and seen by the anaesthetist and the surgeons, and you'd have your general anaesthetic. From a surgical point of view, you would hopefully just have some small cuts in the abdomen, little 1 centimetre, actually 8 millimetre cuts for the robotic ports. You'd have the robotic operation and wake up afterwards. And what we generally find is that patients have much lower pain post-operatively. Their gut has an earlier return to function, so the bowels get working and active much sooner than with conventional surgery, and they're often up and about eating that day or the next day, and that means that you can be walking around the ward and discharged much more quickly back to home, where your recovery continues but is much shorter than with conventional, even open or laparoscopic surgery, and patients get back to work and full range of activities and sport much quicker. All patients are potentially suitable for robotic colorectal surgery. I did a patient just 2 days ago who'd had multiple previous open operations, and we were able to do his procedure robotically. So particularly cancers, colon and rectal cancers, diverticular disease, inflammatory bowel disease, so proctectomies, pouches, colectomies, but really all patients. The robot also particularly lends itself to patients who perhaps have a higher BMI, so are a bit overweight, and for those patients using minimally invasive surgery is often better because it prevents having a large cut on the abdomen, and with laparoscopic surgery that's still possible but can often be quite challenging in patients with a high BMI, but the robot makes it much more straightforward to operate on those patients. Having the Vinci Xi here at the Manor puts us at the forefront of being able to offer the best operations for patients with colorectal disease. Having this technology means that patients who come to the Manor will be offered surgery that is likely to get them with an expedited recovery and with a good oncological outcome, and for patients with inflammatory bowel disease, a precise operation with the least incisions possible and the quickest recovery possible. So robotic surgery is now the mainstay of our practice. I do the vast majority, probably 90% of my procedures robotically, and it's absolutely here to stay. Across the world there's been a huge adoption of robotic surgery because we know the outcomes are excellent, and I think if we look ahead to 10 years time, probably almost all of our surgery will be robotically, from hernias, gallbladders, big bowel resections, prostates, everything. There are huge benefits for patients and surgeons, and it's just the future of our practice. And I think if we